First time in history, studies show the current generation of American children is not expected to outlive their parents, and obesity is to blame. According to the American Heart Association, 1 in 3 children is overweight or obese in the U.S. Pulitzer Prize-winning investigative journalist Michael Moss and best-selling author and food advocate Anna Lapay take us behind the marketing machines, luring our children to a candy land of obesity. Thanks to both of you for being with us. Anna, let me start with you now. In your research, you have found that there is one particular group that is affected more than others by this obesity epidemic, and those are African Americans, right?
Yeah, so it's pretty heartbreaking when you look at the statistics. About 1 in 3 American children born today is predicted to, at some point in their lifetime, develop type 2 diabetes. And that figure for African American girls is 1 in 2. And there are several reasons why this is the case. I mean, partly it's because there is a disparity in this country along race lines in terms of class. So African Americans tend to live in greater poverty, and they are as a result, they have less access to healthy food. When you look at where the fast food industry is increasingly locating its franchises, it's typically in low-income communities, so there's just simply less access to good food. But also, what I think is really important to expose is how the junk food industry and these fast food companies are actually actively targeting African American children more than their white counterparts. So Yale University found that African American kids are 80% more likely to see television ads than their white counterparts, that there's just so much more marketing targeting that community. And when you see the disparity in health outcomes, I think that's where the outrage should really come in, that there's such target marketing.
Yeah, Michael, let me ask you about this. What about, is there a food industry lobby here in Washington or in other parts of the country that's very powerful?
Well, of course. Look, this is a $1 trillion industry, and all they have to do is remind legislators how many people they employ in the manufacturing process.
Anna, you know, one of the things that we've noticed is that the food industry is behaving in many respects like the tobacco industry. You know, the campaign against smoking has been relatively successful in countries like the United States and in European countries as well. So what has happened is that they've started marketing to developing countries. And isn't that happening with the food industry, the processed food industry right now?
Oh, yes, absolutely. There are a lot of parallels. And you're right. I mean, what you're starting to see is that there has been some relative progress in this country in terms of people waking up to this public health crisis, people standing up to these companies, people really trying to improve access and affordability of healthy food in our communities. So what you are seeing is exactly what you described. You're seeing these companies starting to look overseas and see these developing countries and new markets as a potential gold mine. And so what we're witnessing is this sort of exportation of this American diet, as Michael describes it, you know, this high fat, high salt, high sugar diet into countries whose healthcare systems are already struggling to deal with the healthcare issues that afflict those countries. And now they're starting to deal with our sort of very American diet healthcare issues. You look at a country like Mexico, it has the highest per capita consumption of Coca-Cola and has rates of obesity that rival ours. And so one of the things that we stress is that if we are really serious about trying to reverse this epidemic of diet-related illnesses, we can't do it on a country-by-country basis. We really have to work across the globe to realize that, you know, these are companies that are working globally to expand their market, so we also have to organize globally.
Yeah, it's really surprising, Anna, because if you look at a country like Japan, which arguably has one of the best diets in the world, they're now experiencing obesity there as well.
Yeah. I mean, you could go down the list, Japan, China, Mexico, India, Brazil, where I've done some research. And again, what you're finding is that there's just been this real expansion of the power of these companies. You know, you talk about a sort of unprecedented consolidation in the food industry where fewer and fewer food dollars are going into the hands of fewer and fewer companies that have this incredible power through their trade associations, through their lobbying arms to influence regulation, whether that's on the national scale or the international scale.
Yeah, talking about regulation, Michael, I mean, are consumers fighting back? There have been some municipalities, some local governments that are putting restrictions on what can be sold or what can be marketed rather to children?
Yeah, there have been attempts, including here in New York City by the former mayor, to put restrictions on the sale of the very most giant size containers of soda. That got beaten back with firm resistance from the beverage industry. It hasn't gone through the courts totally yet, I don't think, but there have been attempts. They're starting, and people are a little struggling because it's a very difficult thing. And things like the soda tax, for example, on one level could discourage people from over consuming soda, but on the other level, it may further widen this gap between rich and poor in the United States and frankly in the rest of the world. So just how you go at this problem of obesity and diabetes and these food-related health issues from a regulatory standpoint is not easy.
You know, I was looking at something that you've written, and I just want to bring up that analogy with the tobacco industry again. You said that the states accused the tobacco industry of a wide range of deceptive and fraudulent practices, and they rallied behind Mississippi's formidable Attorney General Mike Moore, who took this case up on his own, actually, who said that the lawsuit was premised on a single notion: you caused the health crisis, you pay for it.
Yeah, and I find that really interesting because, look, I mean, I don't see this food industry as this evil empire, well, at least not all the companies, who is sort of intentionally set out to make us overweight or otherwise ill. But on the other hand, I don't see them suddenly getting all philanthropic on us. If they are going to change and start making truly better products, I think that impetus is going to come from a money standpoint, and maybe like the states did with tobacco, which is arguing, look, you caused this problem, you're overloading our healthcare systems, you're going to have to pay for it.
And are we getting enough information about what's in food? I mean, there is now a move to change the nutrition labels that we see on our food. Are we going to be getting real information telling us what's in there, how it's made?
Yeah. Well, again, this is another parallel with tobacco. You think about the movement to get our cigarette packages labeled with warnings, and there's a similar move afoot to try to label sugary drinks. It didn't pass. It was an attempted to pass here in the state of California. It didn't, but I think that other states might take it on. Essentially, a warning label on sugary drinks that says, we know that drinking sugary drinks can lead to diabetes, obesity, and other diet-related illnesses. So you're starting to see the beginnings of potential policies, and Michael mentioned the soda tax. I'm beaming in for Berkeley, California, where we have on the ballot this November, we might be one of the first cities to pass essentially a soda tax, a tax on sugary drinks. And so when you look at the history of regulation around the tobacco industry, I mean, we're talking about 40 or 50 years of organizing and working in the courts and working with regulation and working to limit marketing. And so I think we're talking about, a decades-long battle here, but I think that it's not one silver bullet solution. It's regulation, it's possibly taxes, it's definitely limiting and regulating marketing to children. It's all of those things combined that's really going to turn the tide.
All right, Michael, where do you see it going? I mean, there have been some small legislative victories.
I am obsessed with education and children, and these wonderful programs, still nascent, from Berkeley to Buffalo, New York, that are trying to engage kids either through school gardens or discussions or meaningful classroom work on food, trying to engage them in healthier eating. And if that can happen in a huge way, that's going to save the next generation.
Right, and I just have a little time left. Where do you see it all going? Are you hopeful we can reverse this?
Yes, I am very heartened, and I think books like Michael's is an example of how the general public is waking up. And I agree with Michael. I think education is the inoculation to marketing, and I have seen similarly over the past decade an absolute explosion of efforts all around the country to promote education in schools, to bring gardens into schools, to connect schools to farmers. It's really heartening.
Anna Lepay, Michael Moss, thanks for joining us.